A public hospital, or government hospital, is a hospital which is government-owned and is fully funded by the government and operates solely off the money that is collected from taxpayers to fund healthcare initiatives. In some countries, this type of hospital provides medical care free of charge to patients, covering expenses and wages by government reimbursement. The level of government owning the hospital may be local, municipal, state, regional, or national, and eligibility for service, not just for emergencies, may be available to non-citizen residents. The Brazilian health system is a mix composed of public hospitals, non-profit philanthropic hospitals, and private hospitals. The majority of the low and medium income population uses services provided by public hospitals, run by either the state or the municipality. Since the inception of 1988 Federal Constitution, healthcare is a universal right for everyone living in Brazil, citizens, permanent residents, and foreigners. To provide this service, the Brazilian government created a national public health insurance system called SUS, in which all publicly funded hospitals receive payments based on the number of patients and procedures performed. The construction and operation of hospitals and health clinics are also a responsibility of the government. The system provides universal coverage to all patients, including emergency care, preventive medicine, diagnostic procedures, surgeries, and medicine necessary to treat their condition. However, given budget constraints, these services are often unavailable in the majority of the country, with the exception of major metropolitan regions. And even in those cities, access to complex procedures may be delayed because of long lines. Despite this scenario, some patients were able to successfully sue the government for full SUS coverage for procedures performed in non-public facilities. Recently, new legislation has been enacted forbidding private hospitals to refuse treatment to patients with insufficient funds in case of life-threatening emergencies. The law also determines that the healthcare costs in this situation are to be paid by the SUS. According to the World Health Organization, in 2014, total expenditure on health reached 8.3% of GDP, i.e. $1,318 per capita. In Canada, all hospitals are funded through Medicare, Canada's publicly funded universal health insurance system, and operated by the provincial governments. Hospitals in Canada treat all Canadian citizens and permanent residents regardless of their age, income, or social status. According to the World Health Organization, in 2014, total expenditure on health reached 10.4% of GDP, i.e. $4,641 per capita. Hospital funding in Canada follows provincial health plans, and hospitals are required by law to operate within their budgets. Provincial health plans aim to cover a wide area of medical services and procedures, from hospital records to nutritional care. On average, physician services receive approximately 15% of provincial health funding, while hospitals get around 35%. Even though hospitals are mostly funded by taxpayers, some hospitals, as well as medical research facilities, receive charitable donations. Besides this, there is increasing trend of privatization of some hospital services if those services go beyond provincial health budgets. That is usually done in a form of outsourcing. Hospitals are inclined to outsource any service that is not related to the basic patient care. That includes hospital security, maintenance of information systems, catering service, record keeping. Those services are increasingly provided by private sector. Companies like Data General, Johnson Controls, Versa are main providers of outsourced hospital services in Canada. In the United States, 2/3 of all urban hospitals are non-profit. The remaining third is split between for-profit and public. Public hospitals not necessarily being not-for-profit hospital corporations. The urban public hospitals are often associated with medical schools. The largest public hospital system in the U.S. is NYC Health Plus Hospitals. According to the World Health Organization, in 2014, total expenditure on health reached 17.1% of GDP, i.e. $9,403 per capita. The safety net role of public hospitals has evolved since 1700s when the first U.S. public hospital sheltered and provided medical health care to the poor. Until the late 20th century, public hospitals represented the poor house that undertook social welfare roles. The poor house also provided secondarily medical care, specifically during epidemics. For this reason, these poor houses were later known as pest houses. Following this phase was the practitioner period, during which the then welfare-oriented urban public hospitals changed their focus to medical care and formalized nursing care. This new phase was highlighted by the private physicians providing care to patients outside their private practices into inpatient HOS.